And when you work in global health, you know, one of the first things you learn about is the successful campaign to eradicate smallpox and how successful the polio eradication campaign has been and how close we are. And it's just an honor to be in a room with so many people who are ensuring that that program continues until we reach our goal. And so I'm going to talk a little bit about that today. And I want to start by making sure that we're all on the same page. You guys probably know a lot about polio, but I wanted to start with a short video that really, I think, drives home the impacts of a disease like polio.
My name is Ann Walker. I was born and raised in Livermore Falls, Maine. I had polio way back in 1952, before there was a vaccine available. I had just started kindergarten a couple of weeks when I had the first symptoms of polio. I was literally paralyzed from about here down. No movement whatsoever. It was very scary. When somebody said polio, when I was a child, it brought fear. They told my family one night that they should go home and rest because it was going to be a bad day tomorrow and there wasn't much chance. But here I am. There was a new rehab center called the High Memorial Home in Bath, Maine. I was there for about a year. Extensive physical therapy, often very painful. We were still isolated. Our families could only see us for 2 hours on a Sunday afternoon. And oh, the first step that I made on the parallel bars you walk along, there's a picture of me taking my first step. I was going to walk on my own. I went for about 20 to 25 years, no canes, no wheelchairs, no braces, nothing. And then I started having problems again. Going through that again, gradually losing everything that you've gained, can be very troubling. At some point, I will be totally giving up walking. My children grew up in a family that saw their mother slowly deteriorating. And one of the first vaccinations that my daughter wanted to have for her 6 children was the polio vaccine. It is very important for people to think seriously, because polio isn't a disease that you just get and get over it and you go forward. It's something that comes back to haunt you. We think polio is gone, and it is not. There are still about 300,000 people in the United States that are living with the results of having polio. Polio can kill, and there were many people who never survived.
Okay, so hopefully that, you know, helps to solidify how important this work is. And of course, because I am a scientist, so I have to talk a little bit more about the specifics of polio and exactly what it is. So for anyone who doesn't know, polio is caused by the poliomyelitis virus, and it spreads mainly through contaminated water. It can also spread through contaminated food. And the majority of people who catch polio are actually asymptomatic, so they're not aware. But about 1 in 4 people do get flu-like symptoms. And then you can see here, you know, some of the impacts when you get these complications like the paralysis. On the screen, there's images of children in iron lungs. So thankfully, something that we don't need here in this country anymore. And so talking about those risks and those complications, 1 to 5% of people with polio will get meningitis. And meningitis is an infection and swelling of the brain and spinal cord. Obviously, that can have some detrimental impacts. And then muscle weakness and paralysis, which can cause complete paralysis. And that occurs in, depending on the particular viral strain, 1 in 200 to 1 in 2,000 people who get polio. This can lead to permanent disability, and in 2 to 10% of those people will lead to death. And then what was mentioned in that video is something called post-polio syndrome. So 25 to 40% of all polio survivors will experience some form of post-polio syndrome. It occurs decades after the initial infection, and it's not contagious, but you get back those symptoms of fatigue and muscle weakness, and it can be mild, or as mentioned in the video, the woman in the video expects that she one day will no longer be able to walk because her post-polio syndrome is on the more severe side. So polio, again, even for the survivors, has lifelong impacts. And so looking at polio cases in the United States, we see this big peak here in 1952 when we had 58,000 cases of polio, but a vaccine was introduced in 1955. And you can see how quickly disease declined after the introduction of the vaccine. And in 1979, the U.S. had officially eliminated polio. And so, we had great access to the vaccine since its introduction, although that hasn't been the case globally, as you all know. But this chart shows the great progress that has been made since the 1980s in getting global access to the polio vaccine. And so I want to talk about that because a lot of that came from these initiatives from Rotary. So in 1979, Rotary's first 3H grant, Health, Hunger, and Humanity, aimed to protect children in the Philippines from polio by vaccinating those children. And then just 6 years later, in 1985, Rotary launched the Polio Plus program. And it was the first and largest international initiative to prevent polio through immunization. And then just 3 years after that, in 1988, during that year, polio was still paralyzing 1,000 children worldwide every single day. And Rotary became a founding member of the Global Polio Eradication Initiative, which is still one of the largest ongoing public health initiatives. And the impact has been that Rotary has helped to immunize over 2.5 billion children worldwide in 122 countries, and globally we've reduced cases of polio by 99.9%. And it's estimated that there are 18 million people who are walking today who would have been paralyzed by polio without this vaccine, and 1.5 million people who would have lost their lives that are still with us. So I hope that you all feel proud of being a part of this organization and the great work that they are doing. And just to help us visualize that a little more, the countries that are in red have endemic polio, and this is going through time. When they turn yellow, they've eliminated polio, and when they turn light blue, they've been certified that polio has been eliminated from their country. And so what you see on the map is there are only 2 countries left in red in 2023. Pakistan and Afghanistan are the only 2 countries in the world where there's still active transmission of polio. So again, we are extremely close to the effort, the goal of eradicating polio. So thinking of that, let me see if I can, yeah, so I wanted to give just a little bit of background on how vaccines do this, right? How do vaccines keep us safe and keep us from spreading disease. And so looking at the people who are in blue, the people who are in blue are not immunized. The people in yellow are immunized, and the people who are in red are people who are sick. And so this could be polio, this could be another infectious disease. In the first scenario, when there is either no immunization available, or the population is just not immunized and people get sick, then disease can spread easily through that community. And even when you have a few people immunized, that protects those individuals, but again, doesn't protect the community at large from getting the disease. In the bottom scenario, what you see is the majority of people vaccinated. And for each disease, we have different thresholds of what we call community immunity that's necessary to prevent the spread of the disease. And so in that scenario, even though not 100% of people are vaccinated, the entire community can benefit from the people who are vaccinated. The disease basically cannot spread. And so just looking at not just polio, but other infectious diseases that we now have vaccines for, looking at the bubbles that are on the left side of the screen represents cases at their peak in the 20th century. And then looking at the right side, that's basically how much we've been able to reduce the number of cases thanks to access to vaccines. Oh, and I gave it away there a little bit if you were able to see that slide. But my next question was going to be, so as I said, we've eliminated polio in the United States in 1979. So when was the last, does anyone here know when the last case of paralytic polio in the United States actually was? Anybody want to guess? 2022. In 2022, there was a case of paralytic polio in Rockland County, New York that paralyzed a young man who was unvaccinated. When they looked at the strain of polio, they found that it was a strain that causes paralysis in 1 out of every 2,000 people, estimated. So there's likely a lot of polio circulating in the community, and it happened to be just a pocket of people that were not highly vaccinated for polio. And so they were below the level needed for that threshold for community immunity, and the disease was able to spread. Thankfully, there haven't been other reported cases since then, but even that one case of paralytic polio cost the county $139,000 in a public health response to make sure that people were aware of what's happening, that people were able to get medical treatment. They knew the symptoms if they came down with polio, and then also, I guess, education on the benefits of getting the vaccine. And so, when do people get these vaccines? A lot of our vaccines are given in childhood, right? We have our childhood vaccines, and for a lot of vaccines, we're required to have our kids vaccinated in order to get into school. So kindergarten vaccines are a big thing. And if you look, I'm sorry the labels aren't bigger on these charts, but the chart on the left side is vaccination rates of kindergartners in the United States, and on the right is zooming into Louisiana specifically. And each different colored line is a different vaccine. So we can see that in general there is a downward trend, right? And that's especially apparent these last few years. But I do want to point out, if you look at the y-axis there, we're looking at the top 100% down to just under 92%. So still, by far, we've still got the majority of our kindergartners are vaccinated, even though that is decreasing. And so zooming in a little bit to look at the parishes in Louisiana. So this number is a little different because it's looking at the percentage of kindergartners that have complete vaccination records. So you can see the vaccines that are required in Louisiana on the right-hand side. Sorry about that. And statewide, we've got just under 86% of our kindergartners up to date with all the vaccines that are required for kindergarten. East Baton Rouge Parish specifically is a little bit lower at around 83%. And if you're wondering where that is in comparison to the rest of the state, here we're looking at kindergarten vaccination rates in each parish, ranked from highest to lowest. In East Baton Rouge Parish, where we are now, is number 51 out of 64 parishes in Louisiana. So definitely some room for improvement there. So I want to talk more about, what can we do? How can we help in our community? And I'm going to talk about two different ways. So first I want to talk about the macro level, especially because we're here at Rotary and you guys are great at the macro level, right? Getting a vaccine out globally and ensuring that children all over the globe have access. But I know that you guys also do a lot of important work in the community itself as well, right? Here in Louisiana. And so making sure that we have policies that are set up to promote vaccination, to make sure that people have access to vaccination, that we're protecting vulnerable populations, and that we have a strong, we can have a strong public health response when something like an outbreak does happen. So that's macro level. And then looking at the micro level, we all have people that we know who have questions about vaccines, right? And I think this goes back to before the pandemic. It's totally normal. I remember being a new mom for the first time and I had a question about, the first antibiotic and everything that you go through. You want to make sure that you're making the right decision, especially as a decision maker for your children. So it's totally normal to have these questions, but we need to be talking more, right, to our loved ones about asking open-ended questions. Hey, have you gotten your flu vaccine this year? And if they say no, oh, tell me why, and let them explain. Let them know that you're a safe space for them to talk about their concerns. And maybe you have an answer for them, like, oh, can I give you some more information on this? Maybe you don't, but on the right-hand side are some places that you can go for some really great family-friendly resources on vaccines. And also I have with me, I don't know if I can hand it out, I have with me a little sheet that goes over how you can have these discussions. I know we're all going to be gathering with family and friends in this next coming week, so if this were to come up as a topic, this can kind of help work through some of those conversations. And then finally, I want to just tell you a little bit of what we do in Louisiana. So we are out in the community. We're sharing information about vaccines, about the importance of vaccines, the polio vaccine and other vaccines. We work with great community partners, and we've been around since about 2022, and so we're so grateful to be doing this work, and it's an honor to be here at Rotary talking to you guys about this work. And so if you have any more questions, I'm happy to take them here, and then you can also contact me at the information on the screen. Awesome.
I'm not really sure how to phrase this question because I just don't, but in light of the incoming administration and Robert Kennedy Jr. being head of DHH, being a believer in vaccines in general, what would you say to him and what would the open-ended questions be for him?
I'm not sure there are any open-ended questions that we could ask him specifically, but I would encourage everyone, if this is a concern, to talk to your senators about it, right? So we have, Senator Bill Cassidy. He is a physician, and he knows this issue very, very well, and I think it is of great value to talk to him and tell him, what the concerns are. And I think this is actually a really great time talking to our federal leaders and also our state leaders, because they're really the ones who are going to be putting policies in place. And so, yeah, that would be my answer. Yeah.
I have a question about the virus. For the lady that was in the video who had the long polio syndrome,
Yeah.
does the virus stay in the body, or and so it kind of like reactivates certain symptoms later in life, or is it just that the body gets tired as time goes on, and that's where you get the paralysis again?
Oh, that is a really good scientific question that I don't know the answer to. I don't know. I know that we have some physicians in the room. I don't know if any of them have that answer.
Yeah, I don't think it's the virus that's still there. I think it's weakness related to the long-term effects of polio as a child.
Okay, so I'll repeat that if anyone didn't hear it. She said it's not necessarily the virus itself, but a weakness that's related to the long-term impacts of the virus.
So actually, to add to that, my dad is a polio survivor. He contracted it when he was entering high school. He's now 91. He's still able to move, but he's definitely afflicted by post-polio syndrome, and it's exactly that. It's the wear and tear, the nervous system, and it comes in waves. Some days are better than others days, but he keeps moving. But my question for you, I think back to when I was young, much less my children, and it seems like many vaccines have changed over the years or been combined, right? The DPT and whatever. And I think of polio vaccine being the little thing they drop on your tongue. Tell us more about the current status of the polio vaccine. Is it still that, or there's different forms that can be given, and any other news about vaccines relating to, in particular, the child?
Sure. Yeah, great question about the polio vaccine. So vaccine science is constantly changing. We're constantly moving forward. And actually in the United States, I believe it was in the year, I don't know exactly what year it was, but we did move away from that oral polio vaccine into an injected version of the vaccine. And so the reason was that oral vaccine was actually a live attenuated, so weakened polio virus. But in very rare cases, that virus was able to mutate and actually cause polio. And so obviously once we had gotten to a point that, there was another vaccine available and we had such low cases of actual wild type polio in the United States, it no longer made sense for us to use that vaccine with that risk. So we moved to the inactivated polio vaccine that does not have that risk associated. However, the oral polio vaccine is still used in some countries because it's easier to store, it's easier to administer, it doesn't have some of these logistical burdens that this other form of the vaccine has. So for those reasons, it is still used in some parts of the world.
Last question up front.
Are communities monitoring poliovirus in wastewater?
Not regularly. Not
I
regularly.
just wanted to further clarify about the
Yeah.
polio vaccine. As a pediatrician, we have new vaccines now that are combo vaccines. So it's the same vaccine that you're getting, the IPV, the inactivated polio, but it's along with other vaccines so that the child only has to be injected once. It's the same components, just less pokes, which makes you happy as a parent, grandparent. So right now it's a part of a vaccine called Vaccination, which also protects against hepatitis B and other infectious diseases. So whenever people are confused, they think our vaccines are changing. They're not different. They're just comboed. They're just connected to other, so the child doesn't have to be poked more than once, if that makes sense.
Yeah, thank you so much, Dr. Bouquet. And you asked if there were new vaccines. We actually have a new vaccine for respiratory syncytial virus, RSV, which is a very common viral infection, but for infants, particularly babies under 1, it can be extremely severe. And so there's a maternal version that can be given to mothers, and then the version for babies isn't a vaccine in the way that we normally think of it. We call it an immunization because it's monoclonal antibodies that can protect the child when they're most vulnerable.
And that's called Beyfortus, and we're giving that in the nursery. as they're being discharged after birth.